Hello everyone. Today I'm gonna talk about DeepOpht, medical report generation for retinal images via deep models and visual explanation. I'm presenter Jia Hong Huang. This is the motivation of our proposed work. WHO estimate that typical retinal disease such as AMD and DR are expected to affect over 500 million people worldwide shortly. Quite surprising. Besides, generally speaking, the traditional process of retinal disease diagnosis and creating a medical report for a patient usually will take a lot of time in practice. The fact means that ophthalmologists will become busier and busier. The goal of our paper is to propose an AI-based method to help ophthalmologists to improve their work efficiency and accuracy. In Figure A, we show you a traditional diagnosis or treatment procedure for retinal disease. And in Figure B, we demo you how to use AI-based method to improve the traditional procedure, and we will talk about the detail in the next page. In this page, we show the flowchart of our proposed method. In our method, it mainly contains three types of module: retinal disease identifier (RDI), clinical description generator (CDG), and DNN visualization module. For RDI, is a CNN-based disease classification network, and for CDG and visualization module, we will talk about in the next pages. Yeah, and here, this is our proposed RDI. We have the input is that we have two types of input. One is a retinal image, another one is keyword sequence. Keyword sequence is the diagrams is not from doctors, it's from the real world. So we use this keyword sequence to reinforce our model. And we fuse the multi-model feature and input to another network, such as LSTM, to generate our clinical description. And we also propose a dataset to train our model. In the left-hand side, we show you some dataset example. In our dataset, it contains 3 types of labels: name of disease, keywords, and clinical description. For the right-hand side, we show you the word length distribution of our dataset. And here, we also want to show you the dataset visualization. Yeah, in this word cloud, you can see that there are many abstract words such as degeneration. And so you can see that the dataset is quite challenging. And when we compare to our dataset to existing retinal dataset, we can see that our dataset is unique because we have image plus text. The text star here means expert-defined keyword sequence. When we do our experiment, we have an assumption. We hypothesize that an effective RDI and effective CDG can help improve the traditional retinal disease treatment procedure and help ophthalmologists. And this is the validation of our RDI. We can see that the best result is in the second row based on Simon Yang. And this is validation of our CDGs. We can see that our keyword-driven methods are all better than the baseline models. This is the first qualitative result. This is a generated clinical description. And this is the second qualitative result, because we assume that if our DNN visual explanation results generated by CAM are accepted by ophthalmologists, it means that the proposed method is qualitatively effective. So we propose another dataset with 300 retinal images labeled by ophthalmologists. You can see in the first row, the yellow sketch is labeled by doctors, and the second row is the generated result from our pre-trained model. And the third row is just a baseline. And you can compare the first row and second row. Our generated CAM result match the sketched area. And this is the table-based visualization medical report. Yeah, it could help doctor to do more deeper research or diagnosis. And this is the final conclusion. We propose a method and 2 datasets. Thank you.